November is Alzheimer's Awareness Month. Right now, there are more than 5 million Americans suffering from the disease, including 70,000 here in Connecticut. With so many people directly and indirectly affected by Alzheimer's, now's a good time to promote awareness and talk about some early warning signs you can look out for. Dr. Patrick Coll from the UConn Health Center is here with us this morning. He specializes in geriatric medicine at the Center on Aging. Good morning.
Good morning, Monica.
What are some of these early warning signs we need to look for? I know there are several of them.
Yeah, short-term memory is the main symptom that we see, where someone is forgetting things that they were told a short time ago.
Okay.
If someone's getting confused, maybe confused about the date, possibly their address or where they live, they're getting confused about their finances, sometimes somebody who's forgetting to take their medications, and sometimes issues with language. Sometimes patients with early Alzheimer's disease can have some trouble remembering certain words.
Okay, we're showing you a graphic right now on the screen with some other things, such as maybe forgetting ingredients when you're cooking stuff and things like that.
Yes, if there were tasks that somebody did for many years, they were very competent with those tasks, and now they have trouble performing them, that might be an early sign.
Okay, are certain people more at risk than other people?
Yes, to some degree. Family history can be of a concern, particularly if there were members of the family who developed Alzheimer's disease early in their life. Interestingly, the same things that put us at risk for heart disease seem to put us at risk for memory problems or Alzheimer's disease. So high blood pressure, lack of exercise, smoking cigarettes, drinking excessive amounts of alcohol, all of those things would be risk factors too.
Is there anything that we can do, maybe activity-wise, that can help prevent this disease?
Yes, there's a number of things that can be done. Physical exercise, interestingly, there's more evidence to show that physical exercise can help preserve your memory than there is evidence for mental exercise.
Really?
Yes, there's a stronger evidence. Now, I tell my patients to be both physically active and mentally active. As I mentioned, heart-healthy ideas like making sure you get your blood pressure checked, making sure you get your blood pressure if it's elevated treated, not smoking cigarettes, but I would say that probably physical exercise on a regular basis is probably the single most important thing to help preserve your memory.
So get out and about. It's not just the crossword puzzles then that you used to hear about.
Not just the crossword puzzles.
Okay.
Those, I believe, are probably important too, but physical exercise on a regular basis.
Okay. Now, there is no cure for the disease, but there is hope and help for people with Alzheimer's, right?
It is true that at this point in time, there is no cure. We do have some medications that can help slow down the progression of the illness.
Okay.
There's a lot of research being done to try and find something that's more effective and hopefully in the future a cure for this terrible illness. But at this time, we don't have anything like that that's available to clinicians.
Okay. When is a good time maybe to think about assisted living care?
Assisted living is where someone needs help with activities of daily living. So if somebody needs help, maybe with supervision of medication administration, maybe if someone's having trouble with personal hygiene, maybe they need some help with bathing and dressing. And sometimes if there's safety issues, maybe somebody who's a little bit confused about where they are, maybe they need an environment where they're in a secure environment, and assisted living can provide that.
Now, do you have any advice for caregivers out there? I mean, just as many people are affected indirectly by this disease, and I'm sure at times it can get awfully frustrating to take care of somebody maybe who forgets who you are or why you're there. So what advice do you have for the caregivers?
I think be educated about the illness, understand what the illness does to somebody who has it. Be patient. I think it's important not to try and force somebody to do something that they don't want to do. As an example, we do sometimes see patients have trouble with personal hygiene, and encouraging someone to have a shower is obviously important, but insisting that they do it, that might cause conflict and anger. And in our practice, we care not just about the patients, but we also care about the care providers, and we try and assess their level of stress when they come in for a visit, because we think it's important that they remain healthy to help take care of the person who has Alzheimer's disease.
Great. Dr. Coll, thank you so much. Some good advice for us this morning. I appreciate it.
Thank you.